Good morning, all participants on International Conference on Multidisciplinary Approaches in Social Sciences, Islamic and Technology. My name is Februati Trimurni. I am from Indonesia. I am lecturer at University of North Sumatera. And we are team. And my team is Yovita Sabarina Sitepu and Simpson Ginting. This is my article. The title is Portraits of Services and Institutional Dilemma of Village Maternity Post or Polindes in Indonesian Traditional and Transitional Village. Actually, it is the result of our research. So I hope it is very interesting for you. Okay? It is outline, presentation, introduction, method, literature review, result and discussion, conclusion and recommendation. Introduction. Village Maternity Post or Polindes is a health facility that is prioritized by the government to provide delivery services and health services for pregnant women and children at the village level. The role of this facility is in fact very strategic for villagers for various reasons. However, the Polindes utilization so far is considered not optimal due to the low number of household visits to these facilities. The low number of household visit these facilities basically cannot be separated from the various problems faced by these health facilities, such as the poor healthcare service system, inadequate management and governance, and the competence of midwives. At the village level, the institution and programs implemented by the Polindes should be carried out in a participatory methods and community-based health development. It means Polindes must adapt to the condition and social dynamic of the community expressed as village types, namely traditional, transitional, and modern. So, this study focuses on discussing and analyzing, firstly, the institutional dilemma of the Polindes as part of a community-based health program within the framework of regional and village autonomy, and secondly, the portraits of services presented by Polindes in villages with traditional and transitional typologies in Langkat Regency, North Sumatra Province, Indonesia. Method. This study is a qualitative study and was conducted in Langkat Regency, North Sumatra Province by taking two villages as samples. The first village represents a village with a typology with a traditional typology, namely Desa Kepala Sungai in Sicanggang Subdistrict. And the second village is a village with a transitional typology, namely Teluk Meku village in Babalan Subdistrict. So I have two sample village. Literature review. Here, I would like to mention three concepts or four theories to solve the problems of research. Firstly, modern government management. Secondly, health services. Thirdly, community-based development. And then village characteristic. Yeah. So this concept can solve the problem of the study. Village characteristics are generally differentiated into three forms. The traditional village, a village where relatively independent regional societies in which social activities and social relations occur. The modern village is the antithesis of the traditional village concept, where the social ties of the community are no longer strong and the regional infrastructure development is very advanced. And the last, the transitional village, is a transition from traditional village condition or limitation to a modern village. So my study take two categories, traditional and Transitional village. Result and discussion. As I said before, there are two questions. And the first question, portrait of Polindes services in traditional and transitional village, the case of Kepala Sungai and Teluk Meku village. Kepala Sungai village is one of 17 villages in Secanggang subdistrict, Langkat Regency, North Sumatra province. This study theoretically categorized this village as a traditional village where the universality of culture and community life is still limited. And then Teluk Meku village is one of the 8 villages or kelurahan in Babalan subdistrict, Langkat Regency, North Sumatra province. This study theoretically categorized this village as a transitional village because the culture and life of its people have begun to move from a traditional population to a modern village. So you can see the table, general profile of Kepala Sungai village and Teluk Meku village. Description, there are 12, yeah, total population, number of hamlets, yeah, and then percentage of under village population and so on. Yeah, so different Kepala Sungai village and Teluk Meku village. Yeah. In the context of public services, the two posyandu have not provided ideal public services. The Polyness in Kepala Sungai village in the last 2 years has almost certainly not provided public services in accordance with their duties and functions. Meanwhile, the Polindes in Teluk Meku village has shown an embryo to provide excellent public services. This reason refers to the ideal categorization of public services as stated by Parasuraman et al. A. Effort to provide reliable service have been made by improving service facilities and also establishing daily watch schedules at the Polindes. Secondly, the initiative to visit patients to their respective home should be considered as part of the responsiveness and care for patients carried out by the Polindes. And C, or thirdly, physical appearance and communication provided by health workers are appropriate, such as placing oneself as part of the village community through communication according to local habits. And the second question is the answer. Polindes institutional problems from asset ownership status to sustainability. This study found a dilemma related to the Polindes institution in the 2 villages sampled in this study. On the one hand, the Polindes institution is considered part of the village government-owned institution, and on the other hand, is considered an institution belonging to the district government. Both views are an obstacle for the Polindes to work and maximize its services for villagers. In the context of regional autonomy, district governments have broad authority over the health sector. However, the district government must respect the existence of village autonomy. Village autonomy, with all its limitations and the obligation and authorities of autonomous region in the health sector and the village level, have implications for the Polindes institution in the village. On the one hand, the context of cooperation between district autonomous region and village government is running Polindes as a community-based program create positive synergy. However, this ideal cooperation was not always maintained, especially in Kelapa Sungai village and Teluk Meku village. This study detected at least 4 problems related to this institution, namely institutional status, secondly, sense of ownership, thirdly, loyalty of health workers, and 4. Program planning and sustainability. Conclusion of the study. This study found that the Polindes services at Kelapa Sungai Village, as a village with traditional typology, have not shown the expected performance or are in accordance with the community-based health development framework. This is different from the Polindes in Teluk Meku village, as a village with a transitional type, which has shown a good health service embryo, at least not according to the standard expected by the villagers. The two Polindes experience organizational or institutional dilemma problems. The problem of Polindes ownership, minimal attention to the development of the Polindes, and the lack of commitment of the village government to program and allocate the annual village budget for the development of these Polindes. And the last, recommendation. In line with national regulation on health sector development, the role of the Polindes in Langkat should still be used as the spearhead in providing health services. So the revitalization needed is in the realm of service system, service, accessibility, and cohesiveness of health workers with the community. It is my presentation. Thank you for your attention.